Good afternoon. Hi, Tanya. Hi, Marie-Claude. I'm Eva. I'm Communications Manager for Eurodis, and I'm just helping to Paloma. Paloma, can you hear me? No. I'm just going to tell Paloma that I'm here and talking to you because I think it's...
Hi.
How are you?
Fine, thanks.
Okay, so she's coming now. Sorry for this.
Okay.
She's coming now. Davor, do you hear me?
Yes, hi everyone.
Yes, you're Eurodis host. Okay, great.
That's me.
Davor is our web technologies manager at Eurodis, so we support Paloma with running these webinars. So I'm just checking. I think she needs to log in. I think, Davor, the problem might have been because I'll explain afterwards, but I think I know what it is, so we don't have the same problem next time.
Okay.
Hello. Sorry about the delay. I had a technical problem, and I think other people had too, because I received a couple of emails saying that they couldn't join.
Yeah, Paloma, I think I know what the problem was, so I'll tell Davor and he can sort it out with you afterwards.
Okay, great.
Okay, great. Over to
Thank
you.
you.
Bye.
Hello, everyone. Sorry about that. Okay, I'll share my screen so we can get started as soon as possible. Let me just send an email to the people who have been telling me they cannot join.
If you want, forward it to me and I'll do it.
Yeah. If you can
Yep.
respond to these people, please.
Yep.
And we'll get started in a few minutes. Okay. There's only 2 people who had the same problem I had.
Okay, I'll let them know now.
Okay, I just forward you one and I'm forwarding you the other one. It's Spain and Switzerland. Okay, done. Okay, now I'll share my screen so you can see my presentation. Can you all see it? Yes. Final draft action plan for 2019. It's still a draft. The reason why I call this meeting is so that I can present it to you and I can answer your questions and collect your feedback. This webinar is only for members. And for those who don't know me, I'm Paloma Tejada and I'm Director of Rare Diseases International. I see that we have Marie-Claude Boiteux from Cutix Lexa International. Hello. Harsha from Rare Diseases India organization. And Tanya, hi, are you from Gosher, International Gosher Alliance? Nice to see a face. I've exchanged emails with you, but I didn't know you. Okay, great. I know that someone from the Spanish Federation is going to join us soon, and also Christophe Poinsilit from the Niemann-Pick International Disease Alliance was also interested in joining this webinar. And maybe other people will join us as we go along. I'm terribly sorry about the delay. I will not keep you for more than an hour, don't worry. We will not go over 3:30. So I'll try to be as fast and clear as possible. And please feel free to interrupt me anytime to ask questions or make comments. It's informal. And you can also use the chat box to drop me a comment and I'll read them at the end. Okay, so moving swiftly along, I thought we would start by giving you a little bit of a snapshot of what 2019 might look like, and the activities that we think, me and the council, we've been discussing this action plan since the summer, and we think that these are the actions that are the most important, so the highlights for 2019. So I would like to walk you through that first, give you an idea of what's going to go on and what are going to be the important moments. The most important event beginning of next year is that we will finally become an independent NGO, meaning that we have completed just these past weeks the legal incorporation of Rare Diseases International as a separate entity from Eurordis. As you know, Rare Diseases International was launched as an initiative by Eurordis in 2015, and it was always an ambition since the beginning to develop it and grow it into a separate organization with its own registration, legal incorporation. That is done. So in 2019, we will start operating independently, but of course, we will still benefit from the support of Eurordis, and I will tell you more about that in a few minutes. The other big event early next year is the combined events that we are organizing in New York on the 20th and 21st of February on the Lead to Rare Disease Day. As you probably know, we will be organizing our 5th annual meeting on the 20th of February, and it'll be the first time that we organize a meeting, an RDI meeting outside of Europe. The idea is to couple it with 2 other events. One is the Global Commission to End the Diagnostic Odyssey for Children with Rare Diseases launch report. This is going to be a big event for the rare disease community. It's going to be an important moment because this Global Commission has been working for the past year with developing these recommendations that will have an impact for the whole rare disease community. So we thought it would be a good opportunity to bring Rare Disease International members to this meeting and to organize our General Assembly right before the launch. As you probably know, the Global Commission has been led by Eurordis with Microsoft and Shire, and Microsoft has graciously granted us their offices in New York, their meeting space to hold our meeting. So the beginning of the 20th of February, we will have our General Assembly, then we'll have the Global Commission launch report, and then the meeting will be open to anyone who wants to participate and help us build a strategy for advocating for rare diseases internationally. So all stakeholders, not only patients, are invited to the second part of the meeting. And the next day, the NGO Committee for Rare Diseases is organizing its second high-level policy event at the UN in New York on the 21st of February. So obviously, all the RDI members who are coming to the event on the 20th are invited to stay on for the 21st. So that's going to be an important moment in 2019. And even though that's going to be a very strong moment for advocacy at international level, we of course have to continue throughout the year advocating for rare diseases to be included in the international agenda, and that's why we will continue to what we've done throughout 2017 and 2018, which is to meet with permanent missions from member states in Geneva, where I'm located, and in New York as well, and advocate for rare diseases, targeting it to selected countries. We've done that quite a bit in 2018, and we think we're ready in 2019 to form an informal network of what we will call Friends of Rare Diseases, which are the countries, permanent missions of the countries that have demonstrated an interest and have started working on rare diseases, especially with the National Alliance back home. And with that selected group of countries, we will continue briefing them, educating them, and advocating, organizing briefing breakfasts here in Geneva. We're thinking about organizing 2 briefing breakfasts in the second half of the year. We will also sign an MOU with the WHO. This is a big piece of work that I will tell you more about in a few minutes. We will also organize an informal side event on the sidelines of the World Health Assembly. The World Health Assembly is the General Assembly of the WHO, and it takes place at the end of May every year here in Geneva. And we will also apply for non-state actor in official working relations with the WHO. This is a very complicated process, but we've been told that we could start putting together a dossier, and the June 2019 is the earliest we could submit an application. It is not sure we will get it the first time, but we can always try in 2020, again, if we don't get it in 2019. Moving swiftly along, we will also focus our advocacy work to secure that rare diseases is included in the language of a very important document, which will be adopted by member states at UN level in September next year. It's called the UN Political Declaration on Universal Health Coverage. It's the 3rd political declaration that will be signed, adopted by member states in the area of health in the last few years. Last year, there was one on non-communicable diseases. There was another one on tuberculosis, and now there's going to be one on universal health coverage. And we think we have a very big chance of including rare diseases within this declaration, which of course would be a very important moment for us. The political declaration will be negotiated by member states in July and adopted formally in a high-level meeting in New York in September. We will also grow our advocacy towards a UN resolution on rare diseases. We already had a webinar on that. For those of you who attended, you know the details of what we intend to do with that UN resolution. It's a long-term goal, but we need to work on it as of now. And I invite you to go to our website to see the webinar and to hear Jan Lecam's presentation on the UN resolution. In terms of more practical and internal affairs, RDI will expand its secretariat. For 3 years, we've been working with only 1 full-time employee, which is myself. Of course, I benefited from the back office support of Eurordis in terms of administration, financial, communication. But what we're going to do in 2019 is actually have 3 full-time employees here in the secretariat. And 3 full-time employees, but 4 people working part-time. And this will be possible because we will develop our budget and expand our budget from 160K last year to hopefully 560K next year, where I will tell you more about our funding strategy and plans for diversifying our funding. In terms of programs, we will establish and promote the RDI conference program. These are conferences that will benefit from the support or endorsement of RDI throughout the year. These are some of the conferences that will be included in the conference program in 2019. I will go into more details later. We will also formalize a fellowship program, and we would like to have your input also at the end of this webinar on a new idea, which is to establish a faculty experts for RDI. And again, I'll tell you more about what the faculty experts is all about. Okay, so those were the milestones. It's just to give you a snapshot. I recognize that a lot of it is probably difficult to grasp for people who have not followed everything throughout the years, but feel free to ask me questions, and I think it will become more clear as I move along the presentation. What's important to know is that we've had all these activities fall within RDI strategic priorities, which are 5, the one that I'm showing you now. These strategic priorities were adopted in 2016, and they've been the same throughout. So we haven't changed the priorities. What changes every year, obviously, is the activities that go in these priorities, and that we and that the council decides to allocate budget to. So the first priority is to strengthen RDI as a well-governed and sustainable organization. In order to do that, we pay particular attention to governance, to building a secretariat, like I just said, to communicate with our members, and very importantly, to secure the financial sustainability of the organization. In terms of governance, like I said, we are legally incorporated in France as of last week. We have a council with the members of RDI have elected their council for the last 3 years. It's a council made up of 7 patient reps from 7 member organizations. They meet twice a year physically. They meet on the phone every 2 months. They're very involved, actively involved, as this is a very young organization. And we also have every year an annual general assembly where we adopt the financials of the previous year and the action plan for the following year. And this action plan that I'm describing now will be adopted by all members. The final version will be adopted by all members in New York, February 20th. We also have a policy of relations with commercial companies that I invite you to look at on our website. Secretariat, I think I already told you we're expanding the Secretariat. To be more precise, we will be recruiting a program manager in the second quarter of next year. As part of Euror's contribution to RDI's budget, we will have a part-time public affairs manager, that is to say an employee of Euror's. Her name is Clara Hervas. She works in the Brussels office. She does public affairs, and she will be devoting half of her time to RDI advocacy as of next year. And more importantly, we have already hired a freelance consultant for corporate relations, meaning that this person, someone who, Jill Bonjean, maybe you know her, she's been working for Eurordis for several years, and she will be implementing our fundraising strategy. As part of the in-kind contribution of Eurordis to RDI, RDI will also benefit from the offices that Eurordis has in Brussels, and also as an in-kind corporate contribution from a company called VOZ, we will also have the right to use meeting rooms in their offices in New York. In terms of communication, when we recruit the program manager, we are hoping to expand our communication tools and improve our website and all our communication materials, and be more active on social media, which I have to admit we haven't been very much because I was the only one doing it. In terms of financial sustainability, like I said, those who were in Vienna at our last membership meeting know that the Council of RDI signed an MOU with Eurordis for 5 years. So it starts next year until 2023. And in that MOU, Memorandum of Understanding, Eurordis is committed to providing professional services to RDI in the form of myself, the director. I'm an Eurordis employee, and also the part-time public affairs staff that I talked to you about. And of course, we will continue to benefit, the Secretariat of RDI will continue to benefit from the financial and administrative services and the management of accounts by Eurordis, as well as hosting and maintenance of the website by Eurordis as well. The big, I would say, the most important part of our funding strategy in order to make RDI sustainable, especially now that it's a separate NGO, no longer an initiative of Eurordis, is to look for diversified funding and for funding for its own activities, for its own core activities. So this strategy rests on 3 pillars. The most important one is the creation of what we call the RDI Alliance of Companies for Patient-Centered Action. RDI Alliance of Companies, to make it short. This is a group of companies. Some of them have been approached already. The group will be formal and officially launched next year. But of course, we're building it we have been building it as of September this year, approaching companies to contribute, each one of them 20,000 euros, sorry, to the core activities of RDI, so unrestricted funding. The novel, what is quite novel about this RDI Alliance of Companies is that the companies are not only pharma and biotech. We will approach of the companies that we know already in pharma and biotech, which are of course developing therapies for rare diseases, but we will also approach companies from further afield, from other sectors, especially digital and medical devices, diagnostics. I'll show you the list in a few minutes, but it's a quite diversified profile of companies. And we will also raise restricted targeted funds for specific programs like the ones that I mentioned, the conference program, the faculty expert, and the fellowship program. Okay, so this is the RDI Alliance of Companies. I think it's worth taking a few minutes to go into a little more detail on this because it's going to be so important for RDI. Like I say, it's only made of commercial companies from different industry sectors, pharma and biotech, of course, but the idea is that from the start, we want to engage with also other companies from other sectors, diagnostic devices, digitals, CROs, and even public relations and law firms and completely different sectors that are very interested in rare diseases and that have an interest in being part of the same group and interacting amongst each other and with the patients themselves as well. So we believe has a very good chance of working, and the core of the funding strategy really relies on the success of the RDI Alliance of Companies for Patient-Centered Action. Of course, the companies that decide to become members will sign a code of conduct, will adhere to the policy on relations with commercial companies, and they will obviously be invited to our meetings and our annual meeting, policy events, level 3 RDI conferences, which I will explain in a minute, and we will organize 2 webinars a year for their information. Okay, so moving into building a legitimate global rare disease patient alliance. So this is the second strategic priority. Before I go into the second strategic priority, would anyone like to comment on the first set of slides? I know some of them are quite technical and it's a lot of information. but if you want to ask a question or make a comment, you can do it now. Don't hesitate to unmute your microphone or just drop a chat. Okay. In the interest of time, I will move on. You can always ask questions anytime you want and at the end as well. So in terms of building a legitimate alliance, like I was saying, RDI will not be legitimate without its membership base. So it is always from the beginning and always has been a preoccupation to make it a real organization with real patients and members behind it. It's a grassroots organization. As you probably know, members of RDI are mostly national alliances or international disease-specific federations. They're all umbrella organizations, and they're made of actual patient reps and their families. In 2018, we had 56 member organizations, 33 national alliances, and 14 international federations with 4 regional networks as well. We would like to expand that to at least 10 more in 2019. We are looking to target more specifically international federations from diseases that are not included in the alliance yet. This is just some of them: cystic fibrosis, Duchenne, and many others, Dravet, Rett, who are not yet part of the network, and we think we could contribute a lot to our work. We see the event in New York, having our annual meeting and event in New York, as an opportunity to maybe engage with these international federations which are based in the US. In terms of national alliances, we're going to target more specifically the countries that you see there, where patients are quite well organized and mobilized and where we already have contacts. Peru, Brazil, Chile, and the Philippines. Actually, the Philippines has just become a member very, very recently. We will maintain informal relations with the Taiwanese Foundation for Rare Disorders, which is an alliance, very important pioneer in the field of rare diseases, but who unfortunately is not considered as a member state in the UN system, and that's why they cannot become formal members of RDI, but we will continue to engage with them informally. And next year, we will definitely add to our list of members the Asia Pacific Alliance for Rare Diseases, which has finalized, let's say, its formation and is now ready to become a member. And we will explore links with the African Rare Disease Alliance, which is also more mature this year. And we will call for membership fees, which we haven't done very much, and which we need to, not only as an income stream, but also to make sure that our members are committed and engaged as much as possible. These are the strategic partnerships that we're engaged in and that we will continue to develop next year. Of course, we are members of the NGO Committee for Rare Diseases. Our chair, Duran Wong Rieger, is a member of the executive board. We also have another member of our council, Ritu Jain of Deborah International, sitting in the International Rare Disease Research Consortium, and more specifically being very active in the Patient Advocates Constituency Committee of IRDIRC. So we're very much present in the research consortium. We also have very strong links with Orphanet. They are currently working on redefining the global figures for rare diseases. Of course, this is something that we're very interested in, and we will definitely promote and communicate that work when it's ready in 2019. We will also support them in their efforts to include rare diseases in the international coding and classification of diseases, ICD-11. And try to promote Orphanet as much as possible in the countries where we work and where we have patient contacts and where they are not present yet, especially where they're in countries where there is an interest and resources to translate the database into their local languages. We will continue, I would say, and upgrade our partnership with the International Federation of Pharmaceutical Manufacturers and Associations, the IFPMA, which is based here in Geneva. They have a working group on rare diseases, and they want to organize a roundtable next year with us here in Geneva, a roundtable on barriers to expanded access to orphan drugs in lower middle income countries. So you'll be hearing more about that later on, and we'll be inviting some of you, the ones who are interested and for whom this is relevant. I'm thinking about the Gaucher Alliance in particular, to participate in this roundtable. We're also looking to engage more and more with the Asia Pacific Economic Cooperation, the APEC. This is an organization that we didn't know about until recently. But thanks to the Asia Pacific Alliance of Patients, we have been in contact with them. They have launched the rare disease also working group, and they're very interested in RDI being a partner, providing input, the patient input into their rare disease action plan. So the APEC Rare Disease Action Plan, actually I invite you to look at it on their website. When implemented, it will be important for the 21 countries that are members of the Asia Pacific Economic Cooperation. And lastly, but not least, the Global Commission on Ending the Odyssey for the Diagnosis of Children with Rare Diseases, which I already mentioned before. This is an important commission that will be releasing its recommendations in February. RDI has been providing input to the recommendations and will support the promotion of the recommendations and the implementation of 2 of their 4 pilot projects in 2019. Anyone has questions or comments regarding the second priority, which is to build a legitimate global rare disease patient alliance? Okay. The third one is the bulk of our work. The third one is to advocate for rare diseases to be an international public health priority and raise awareness for rare diseases worldwide. So obviously advocacy is the bulk of RDI's work. We are an advocacy platform. That's what we do. And the rest is adds to it or is supportive of that core mission, which is to advocate and to carry the voice. In terms of advocacy, next year we will work a lot more on promoting rare diseases as a priority within the UN Sustainable Development Goals agenda, and continue pressing for the adoption of a UN resolution on rare diseases. So like I said, the resolution is a long-term goal, but the work to advocate for it and to argue for the benefit that as a resolution like that could have on rare disease policy in different countries is work in progress, and it's work that will be done, that has started in 2019 and will continue very much so in 2019. The new emphasis in 2019 will be on universal health coverage, which is the top priority of WHO, and is the basis of the political declaration that will be adopted by the UN in September. So you will be hearing a lot about universal health coverage and how rare diseases fits within that agenda. And then very, very importantly, establishing a collaborative framework with the WHO will also be a very important objective in 2019. I'll tell you a little more about that now. And build an evidence-based advocacy, and I'll also tell you what we mean by that. Okay, I will not go into too much detail because I have already on how we plan to go about advocating for rare diseases within the Sustainable Development Goals agenda and the Universal Health Coverage agenda. I explained that already. It's going to be through the permanent missions in Geneva and New York, mostly, but also in coordination with the National Alliance back home. So we work very much in tandem with the national alliances when we advocate to the country representatives in New York and Geneva. In terms of our advocacy committee, which is the body that drafts and adopts our advocacy positions, we're going to invite 2 new members, the Argentinian Alliance and Thalassemia International Federation. But this advocacy committee is open to any member who wants to join. So if you're interested, let me know. And the council will review applications ongoing. We have already actually started building drafting groups for the UN resolution and the Universal Health Coverage contribution. And the staff who will be supporting all this work as of 2019 will be Clara Hervas from Public Affairs at EURORDIS. So like I said, I don't want to repeat myself, in order to promote rare diseases and international as a UN, within the UN SDG agenda, we will co-organize the meeting in New York with the NGO Committee for Rare Diseases on the 21st of February. So RDI is formally a co-organizer of that event. And it's RDI who will draft the first draft of the resolution and present it as a contribution to the NGO Committee. There is a possibility, but this depends a lot on member states, and they're willing to do it. But there is a possibility of also organizing a high-level conference of permanent reps if one of the member states agrees to sponsor it. And like I said, universal health coverage will be a very big topic next year, and we're trying to introduce rare diseases within that dossier, and these are all the actions that we're planning to carry out in order to do that. The highlight, and the one that you're invited to as regular members of RDI, is the informal side event that we will be organizing on the 23rd of May here in Geneva on the sidelines of the WHO's 72nd World Health Assembly. So that is, you could save the date now, 23rd of May. Will be an important day to move that advocacy forward. Okay, so going straight into the WHO RDI collaborative framework. Okay, this is a document that is very well known by the advocacy committee. So those who are part of the advocacy committee have been presented with the document. They have contributed to the document, and they been part of several consultations in 2018. We're at a stage now, we're discussing with the WHO, and we're at a stage where they have asked us to provide a final version of the document in order to use it as the basis of for having an MOU with them. So in the memorandum of understanding, when we sign it next year, it'll be an important moment, because in that memorandum of understanding, there will be very clearly stipulated all the activities and actions that the WHO will be committed to developing with us. So that's an exciting opportunity that we'll be working on very much so in 2019. I won't go into all the details because it's repetitive of what I just said. And we would also like to work on advocacy fact sheets. So once the key figures, global figures of rare diseases which are hard to get, as you know. Once those are officially published by Orphanet in that paper that I mentioned before, we will use that as a basis to produce fact sheets on these key figures that you will be able to use in your own advocacy work and with your own members. We would like to also develop the fact sheet on the surveys that, a compilation of the surveys that exist already on the social impact of rare diseases. And we will continue to explore a way to develop the international state of, what we call the international state of the art of rare diseases. For those who know the European state of the art of rare diseases, it's very, it's a very important document that states validated information on the rare disease landscape in all of the EU member states. And we would like to do the same at the international level. Okay, so the fourth priority is to advocate for people living with rare diseases at a global level in key areas. And the three key areas selected for next year are research, diagnosis, and access to medicines. So these are really the three focal areas where we will be devoting most of our energy. In terms of research, this will go through engagement with IRDIRC. Like I said, we have a representative in IRDIRC, and we will also be very much involved in co-organizing a conference with the REACT conference that takes place every 2 years with researchers. Access to diagnosis, we will continue that work through the Global Commission to End the Diagnosis Odyssey of Children with Rare Diseases that I mentioned before. And access to medicines will be done through the partnership that I was telling you about with the WHO, and also through the roundtable that we're planning to organize with the IFPMA. This is the detail of how we're planning to engage with IRDIRC and with the REACT community. The REACT community is a community of scientists, rare disease scientists, and they have been organizing a conference called the REACT conference every 2 years. Next year they will do it in Canada, and we will be partnering with them and with the Canadian Organization for Rare Disorders, who's a founding member of RDI, in order to organize a rare disease conference, international conference, let's say, one of the few international conferences for rare diseases actually that will really focus on policy and bring in all stakeholders. So that's going to be on the 5th to 8th of May. Okay, so a little more detail on what we're planning to do with the Global Commission. I spoke enough about the launch event and how we're going to be integrated into that. A week later, on the 20th of February, there'll be another launch event, this time in Beijing, China, and that will be hosted by another member of RDI, the Chinese Organization for Rare Disorders. The idea is that RDI wants to be very much part of the promotion of the recommendations. RDI will help communicate about those recommendations and will actually take part in 2 of the 4 pilots that have been recommended within the report. And we will use the recommendations of the Global Commission as a basis to develop the RDI position on diagnosis. That will not be done next year, but the work will start next year. And we have already brought in the recommendations from the Global Commission experts group into the collaborative framework with the WHO, which, as I said, will be the basis of a memorandum of understanding that hopefully will be signed next year. Access to medicines, which of course is a topic that is of interest to all. Again, it's included in the collaborative framework with WHO, especially in order to improve access to medicines for lower middle income countries. And I invite you to look at the collaborative framework. If you're not part of the advocacy committee, you probably don't have a copy, so just ask me for one and I will be happy to send you. It's a draft still, but you will see very much all the details of the activities that could be, that we're proposing in order to improve access to medicines in lower middle income countries. We will also mobilize political support of member states through the permanent representations in Geneva to include access to medicines for rare diseases in the WHO fair pricing agenda. So we will be very much part of the discussions on fair pricing next year here in Geneva. And as I said, organize the first roundtable on barriers to expanded access programs in lower middle income countries with the IFPMA Rare Disease Working Group, first quarter 2019. We're hoping to organize a second roundtable in the second half of the year, and this time more focused on innovative access programs. Also always with the IFPMA, but extending not only patients and industry, but also trying to bring in the WHO and other global actors like the Health Technology Assessment International. Okay, so the last one is actually the one that I suspect you will be more interested in the sense that, or at least we are, the council is very interested in hearing your views on this, because it's about building capacities of members. And they're very interested in having your feedback and your input on how best to do that. For the time being, what's on the action plan is obviously to keep on organizing the annual meetings, because we think that's a very good opportunity for patient advocates and member organizations to build their own capacities as patient advocates, to exchange information, to network. So it's not only a meeting where you get information, but it's also a meeting where you can actually meet others with similar interests. What's new next year is that we're going to establish very formally the RDI conference program. And this program actually has been decided because of the requests of many member organizations. Not many, but some member organizations have requested RDI throughout the years to support their own conferences in their own countries, and to give them the international dimension so that they can move forward their own national policy. And so we have seen that that's a need, and something that our members have been asking for. Same with the fellowship program. Faculty of experts, I'll explain in a minute what it's about, because it's something very new as a concept. And then of course, for RDI, it is very important to keep on being a forum for peer-to-peer exchange and networking. So we would like to implement or start physically having educational training toolkits for members, but also building a virtual platform for networking. Now, we only will be able to do that if we recruit and when we recruit the program manager, because I will not by myself have the capacity to build a virtual platform. We have been talking about it for a while, but we have never been able to launch it because of lack of time and resources. So next year, with this extra staff, we have a better chance of getting it off the ground. Okay, so this is the annual meeting. This is what the agenda is going to look like. We will be sending out the official agenda very soon. I hope some of them you are able to come on the 20th of February. And like I said, it's a very important moment for rare disease patient organizations to meet and network, and also to network with the other stakeholders, not only with patients. The conference program, there's 3 levels. Any member organization can apply. The level 1 will be conferences just supported by RDI, so it's just communications. We will provide the logo, and we will promote your conference on our website. These are usually conferences organized by national alliances or international federations, and it's basically an endorsement of national conferences or international disease-specific conferences. Level 2 is more commitment on the part of RDI. These are conferences in partnership with RDI. So we expect someone from RDI to be in the program committee, and we have allocated budget for some 4 or 5 speakers, RDI speakers, to attend, speak at the meeting, but we would not provide fellowships. The objective of supporting level 2 conferences will be to build capacities on specific topics that correspond with our strategy. For example, national plans or registries. So if your conference includes that kind of topic, which is cross-cutting and international, then RDI, it could be considered as a level 2 conference and can be part of the program. Level 3 is the one that requires the most commitment from RDI in terms of budget as well. These are conferences co-organized with RDI. We're only planning to do 2 next year, maybe 3, but most probably only 2. One in Toronto, Canada, the REACT conference with CORD Canada that I've been talking about in May will be a level 3 conference. And then we are still looking to identify another organization that would like to co-organize a conference with us. Level 3 support means everything that you get as a level 1 and 2, but with fellowships. So there is a small portion of our budget which is dedicated to supporting the travel and the accommodation of patient participants in level 3 conferences. Of course, to be a level 3 conference, the content of the conference has to be aligned with RDI's overall strategy and advocacy topics. So far, there's 1 level 3 support conference already as part of the program. And these are also conferences, the ones you see in italics. Level 2, for example, would be something like in the past, informally, we have been part of the Nord Summit, the European Conference on Rare Diseases, the World Orphan Drug Congress, and we're looking to maybe partner or have in our conference program ISPOR. Apardo is also organizing conferences in Singapore every year, and Alibear, which is the Ibero-American Rare Disease Alliance. They have organized also our conferences every year in a different country in Latin America, and could easily benefit from level 2 support. Okay, so I'm getting to the end. I'm looking at the time, because I do want to have some time to discuss with you and hear what you have to say, and if you want to include something. We're still on time. As I said, this action plan is not final. It will be circulated to all members at the beginning of next year, so that it's actually adopted at the annual membership meeting on the 20th of February. Okay, so the fellowship program. As you can imagine, a fellowship program would be to build capacities of patient advocates, and to the number 1 objective is to actually identify and train leader patient advocates in the different countries. and for different diseases. So that's the number one priority of the fellowship program. We're also, obviously, we would like to enable RDI members to attend our meetings. And we know that most of them cannot attend all these meetings without some kind of financial support. And the idea is also to support networking, like I said, and exchange of experiences and promotion of best practice throughout by attending these meetings. It will be available, the fellowship program will be available for the annual RDI membership meeting. So the call for fellowships closed actually at the end of November. We have given out 18 fellowships to attend the New York events, the 3 of them. There will be a call for fellowships for all level 3 conferences as well. And for the WHO World Health Assembly side event that I mentioned before, as well as training seminars to be an idea would be, for example, we have sent fellows to the Eurody Summer School in the past. We have devoted a small part of the budget to sending a few people to that training opportunity, but I would be very interested in knowing if you have other ideas of training seminars that will be of interest to you and that you think could fit into the RDI fellowship program. Okay, don't worry, I only have 2 more slides. But I do think, again, that we need your input more than ever when we're about to launch these programs, because we want to make sure we got it right and that this corresponds to a need from our members, and we're on, checking that we're on the right track. The faculty experts is a new idea. The idea is to form a group of individuals, not organizations, individuals who would be appointed by the council and that could apply to provide, number one, a pool of quality speakers for our conferences, because as you can imagine, we don't have enough speakers that can actually that we could tap into. There are many in our community, there are many experts and from different sectors that could actually be very relevant and contribute quite a bit to our discussions, but they're not organized in any way, and we cannot ask them to participate as speakers. So this would be a way of organizing the commitment from individuals who are interested in giving of their time and their experience to the cause of rare diseases. When I talk about individuals, they can be retired or active. They can be patient advocates from other diseases, non-rare diseases. They can be academics, representatives of learned societies. They can even be employees of commercial companies and even pharma and biotech, or can be experts by themselves. So we, throughout the years, have met people like that are willing and very enthusiastic about contributing their time, but they don't know how to do it. And this would be a way of organizing their support. Of course, there will be a limit in time. If you're a member of a faculty of experts, there will be some terms of reference that would specify your commitment and what you can do, what you cannot do, and for how long. It's not for life. You're not on the faculty experts of RDI for life, but it's a commitment that you could have 3-year terms that could be renewed by the council. Like I said, it provides a pool of quality speakers, but it could also provide an expert resource for you members, for your specific activities, for your projects, if you need expertise on something in particular, or they could also provide expert advice to the RDI Advocacy Committee on very technical and specific topics. So it's a way of cultivating committed individuals, also to link back to their organizations and hopefully foster collaborations in the future. And some of them will be also interested in producing scientific publications that could obviously be of benefit to RDI. Okay, so on to my last slide before the budget. This is all pending the recruitment of the program manager, which we're hoping to recruit in April, March, April. This is all pending the financial resources that we will secure. And we're already starting, of course. We have some few pledges, but the actual funding will not come through until January because we were not legally registered until now. Once all that is done, we will be able, there's enough resources, financial resources, we'll be able to recruit a program manager. That person will be able to work more on what has not been done so far, which is to create this virtual forum for the RDI community. We're looking into a software called Facebook Workplace that some of you might know. And also, the idea would be to have more communication, more regular communication with members, organize more webinars, and also not only webinars, but meetings, online meetings, so that you can actually share, for those who actually cannot attend the meetings physically. The advocacy training toolkits is another idea that the program manager would help implement. The idea is to train patient reps to speak about global initiatives and talk to their governments and policymakers with this toolkit, and to maybe use the toolkit to also educate your own membership and support local advocates. And then the last idea that I would like to leave with you, and you can think about it or you can react now, is producing educational training toolkits on very technical and hard to understand topics like gene therapy. As you probably know, our chair, Duran Wong Rieger, was a board member of the International Alliance of Patient Organizations. And they have a toolkit on biosimilars, which is very interesting. And she's thinking about using the model of that toolkit to produce one on gene therapy. But first, would like to know if this would be of interest or of benefit to you at RDI level, or if there are other similar materials that exist already and don't need to be replicated. The idea obviously would be to make these toolkits accessible to a lay audience, so to any regular patient that needs to understand in order to advocate. Okay, so this is the budget. I think I'll stop here. If you have questions, please go ahead. And it's not very easy to understand, but I think the best way of describing the budget is that it's small, but it has been expanded quite a bit. It's very ambitious in terms of its funding target. We're talking about a total of 560,000, of which 100,000 is a volunteer valuation of volunteer time. So in actual money, it's 460 total. It's divided between Eurordes contribution and then the money that RDI will have to raise for itself and by itself next year. And it's also divided in what I call core expenses. So obviously staff and the events that we have committed to organize, communications, and our contribution to the NGO committee meeting in New York. And so that's a total of 460. And then you have the conference program and the fellowship program for a total of 85. To that, you need to add overheads from Eurordis, who is actually managing the funds. And we come to a total of 560. So that's the general overview of the budget. You see in the these are the expenses. I just talked about the expenses. The income will be coming from membership fees, the volunteer in-kind contributions, and mostly the RDI Alliance of Companies. Also 85 from programs, conference and fellowships, and 198 from Eurordis. But as you see, the bulk of the budget relies on the success of the RDI Alliance of Companies. Okay. Anyone wants to say anything? And don't feel shy about it, because not everyone is at the same level of information and understanding. So you can ask any question you want. No? The strategic priorities, should they be changed? Or the actual activities in terms of advocacy, or in terms of capacity building, or just in terms of practical expenses that we will engage next year for fellowships and conferences? No?
Paloma, the only thing I was going to say is,
Yes.
You talked about the educational toolkit, and you talked about the biosimilars and the gene therapies.
Yes.
So when we had just to share some experience, when we had our members biannual meeting in October, we had representatives from all of our 50 countries. We actually had a speaker on biosimilars to really bring it down to the basic level. The biosimilars is a very interesting topic, particularly for orphan drugs and high costs. And just to share with you that we actually had some fantastic feedback from all of our members, because I think it was something that they knew about, but it was quite complex, and by having it pitched at a really lay level, actually now they feel quite confident in terms of maybe going back to their own organisations and having that conversation. So I personally see a real value in that type of support.
Excellent. So that was a speaker that came to your conference in October?
Yeah, it was Dr. Dingerman. He was from Germany, and it was through one of our members. And he's very good at doing things like that. He's done one on gene therapy before, and he really sort of like strips it back to the real sort of basics.
Yes,
it's very visual as well. He described biosimilars. He used like pieces of furniture and things like that, which actually, bearing in mind that we had people from all over the world there, so English was not their first language. I think that was important as well.
Very important. Yes, we obviously have that problem as well, and we need to make it as simple and clear and lay as possible, like you say. I'll be very interested. I'll get those details from you later. Have you considered using the material from that conference to to have some kind of kit or tool that you can actually, have other people use?
We haven't, but it's something that I could investigate.
Okay,
And
great.
I'd be willing to, to
Great.
have a discussion with Professor
Yes.
Newman and then maybe yourself.
Okay.
Okay.
Good. Yeah, let's do that, definitely. When we're ready to take off with this program. I know Duran Monrieger is very excited about it and very pushing for it. But I also know that she's looking for that kind of feedback like the one you just gave us, or like I know someone, or I know where to get the information, or so that we can actually compile it, because we don't have the capacity, obviously, to generate that information from scratch. So that's perfect. Thank you very much, Tanya. Everyone else? Okay, 10 more minutes. I won't keep you for more than an hour, I said. I recognize there's a lot of information to digest, especially for the ones who don't follow this regularly. The only thing I can tell you is if you have afterthoughts, if you have comments, if you have questions, if you have ideas of practical activities that you would like to see in the work program for next year of RDI that you think are relevant to our work and that fit the strategic priorities. If you want to change the strategic priorities, that's also something that could be open to discussion. But if you have any of these ideas, sometimes you feel more comfortable doing it by email, or you can obviously call me. Also, we can set up an appointment, a phone appointment. But feel free, because like I said, this is not written in stone and it's not decided only by the council. These are actions that the council wants to implement very much in consultation with you, the members, and not only because of democracy, but also because it's the only way of making sure that it's actually of benefit to the people on the ground and the people that are actually carrying out the work locally, like you are. So think about it. I will put this presentation on the website so you can see it again. This webinar actually has been recorded, so you will also be able to hear it again if you want, or just look at the presentation. And maybe just focus on that part of the presentation that you feel is more relevant to the work that your organization is doing, and that you would like to provide more specific feedback on. And if you're completely against the strategy in terms of advocating at the UN level, for example, if you think there's other ways of doing it, please don't feel like you don't have a voice, and your input will be taken into account. The council will be meeting in January again. It meets every 2 months. And all the feedback that I get before the 15th of January can be included in the discussion that they will have. The date hasn't been settled, but it'll be the second half of January for sure. So I leave you with that idea. Thank you for that comment, Tanya. I knew that was something that the members, especially international federations, could be helpful with, because you do have a lot of experience educating your membership on research topics. And also, if you have other organizations that you know that you think fit the profile and would benefit and contribute to becoming a member of RDI, let them know and invite them to the event, to our meeting on the 20th of February, because it is in the afternoon. Like I said, it's open to anyone. The idea is also to attract new members at that meeting and to get them to know our work, so that we build the alliance, a stronger, bigger alliance every year, like I said, the target for next year is 65. So hopefully at the end of 2009, we'll be at least 65 organizations members of RDI. Okay, I'm going to leave you now. Last chance to ask a question or make a comment. I'm just checking who else managed to join us in the meantime. I was expecting, like I said, Neiman Pick and the Spanish Alliance, but I guess they didn't manage to connect. I see there is also Malta. William, hi, thank you for joining us, and Hatija from the Malaysian Rare Disease Society. Thank you for joining us too. Okay, I think I'll leave you with that. I would like to just show you the milestones once more so that they keep them in mind. As you see, most of the highlights are concentrated in February and May, but there will also be conferences joining the conference program that you will be hearing about in the second half of the year. If you want to organize a conference and you would like the conference to be endorsed by RDI and part of the conference program, let me know. And if you would like to attend the informal side event in Geneva at the end of May, also we will be, of course, sending out an invitation and a registration link, but if you want to let me know as soon as possible, that will also be helpful. Okay. Thank you very much for your attendance and for your time. Let's keep in touch. It's very easy. Just drop me an email and I'll be happy to discuss this further. Okay, I'm gonna stop this webinar now.
Bye.
Bye, everyone. And next week, you can expect to see this presentation on our website if you want to look at it again.
Okay.
Thank you.
Bye.
Bye-bye.